What we hear in the office when we see patients with diabetes who need a change, they're at a point of adding a new medication. A lot of them say, can we wait another 3 months? Can we wait another 3 months? And sometimes 2 or 3 visits will go with, oh, I'm not watching my diet now, I'm gonna go do it. What are my messages to the patient is, I understand that lifestyle changes are hard, but we can start the medication and do it together, and do the lifestyle changes with the new medication, and then we can always go back. Delaying might cause the start of complications, and then by the time you start, it might be too late. There's some complications that once we reach the point, say with kidney disease and nephropathy, and once you reach a point that's progressive, it's going to be very hard to reverse it back to no nephropathy or kidney disease. So when is it really important to start medication or follow the advice of your physician is all through the course of diabetes. In fact, sometimes if you delay starting medication, the medication won't even work, because for diabetes, it's a progressive disease. And at some point, your pancreas won't respond or your body won't respond to tablets. And even when you go to injectables or insulin, if it's not done at the right time, you have to use much higher doses, and it's much harder to get you under control. So delaying actually will make it harder for the patient and for the physician. So when the recommendation comes, the quicker you take it and the quicker you deal with it, you can always go back. I always tell the patients, if you take this medication today and in 3 months you come back and we look at your average and you've done extremely well, we can always lower the dose or stop some of your medication. So it's not a one-way route, but to do it early will actually save you time and save also the pancreas, where you might be able to just delay going on an injectable drug or delay the progression of the disease. But if you leave it late and your glucose levels are very high, most of the time we have to start with multiple medication at the same time, which makes it harder on the body. The side effect profiles go higher. So you might be able to do with lower dose of medication, with less medication, if you take it early. So don't delay and don't leave it till you feel the symptoms. So that's the take-home message. And if you didn't have the time to do the lifestyle now, do you really think you're going to have the time in 3 months or 6 months, unless something else is changing in your life? So we have that conversation. And obviously there are a few people that say, you know what, now I have time, now I'm changing jobs, now I'm doing this. And obviously taking 3 or 4 months is okay. But if you don't think there's going to be room for it, don't delay it for 3 to 6 months, because that's the time frame you need to have complications and make the medication less effective.